In South Carolina, the problem that we identified was that there is a big gap between pregnancy prevention information and preconception health, or just general health information for adolescents. So we decided to target the 18 to 20-year-old adolescent population, primarily because this is a difficult group to reach. They're not in high school anymore. Many of them have not gone on to college, and they're just there. So how could we reach them? In order to do this project, we brought together the Department of Health, the Department of Education, the South Carolina Campaign to Prevent Teen Pregnancy, and we also had a representative from some teen health centers across the state, just so that we could have their perspective as well. When we started the project, we really didn't know what we wanted to do, how we should disseminate this information. So for us, our first step was to have focus groups with the target population, as well as to do a literature review to figure out what's been done, what worked, and what didn't. And this, after doing all of that, we came to the conclusion that a website would be best for our project. And that's where our strong partnership with the Campaign to Prevent Teen Pregnancy came into play.
Hi, I'm Shannon Flynn, and I'm with the South Carolina Campaign to Prevent Teen Pregnancy. And as Brianna mentioned, who's with our state public health agency, our Department of Health and Environmental Control, mentioned that once we decided we wanted to do a website, then sort of our next question was, how are we going to do that? And through just really some good fortune, the organization that I work for that was already part of this collaborative was developing a youth website. Now, this youth website was originally designed to provide strictly information about pregnancy prevention and STD prevention. And so we started partnering with them and really having some discussions about broadening the scope of the website. And ultimately, we negotiated with them about what we wanted to include and how much sort of space we would get on the site and how that would all work. And ended up really having, I think, a great example of a partnership that really benefited both groups. As part of the Preconception Health Collaborative, we benefited from piggybacking onto a much larger project, and so we were able to integrate our information with something that was already being developed. We didn't have to pay separately for a web developer. And I think really, both as part of the collaborative and as a representative of the organization that is hosting the website, we realized that it was great to have additional information. And actually, in our early testing of the website, it just launched on January 4th of this year, we actually saw that young people really liked the additional information that sort of spoke to the broader topic of preconception health, so thinking about nutrition and obesity and exercise and substance abuse. But one of the things that we also heard from them is that they wanted more information about it. So kind of as we're moving forward, our next steps are really to promote our website and hopefully to really get the information out there to our target population, and also to keep enhancing the information that's on it, so we're building it and growing that information as well.